Hello, everyone. Welcome to the Pegasus Institute Emerging Leaders Network webinar for the September session. And we're going to have a recording as well. So if you can please agree to it, that'll be great. We have people from different time zones that we're watching in, so that if they can't join it right now, they can watch it later. And it's my pleasure to introduce our speaker for the September webinar series, Dr. Olha Horbach. She is going to talk about her journey from Ukraine to Canada, and currently she is a research assistant in clinical neuroscience at the University of Calgary. And we're really happy and proud to have her speak today. And the floor is all yours, Ola.
Hi, everyone. Thank you so much for having me today. I'm really excited to talk today. And so I'm going to start with sharing my screen. So thank you so much for your introduction. As it was mentioned, my name is Olha, and I graduated from Poltava State Medical University in Ukraine in 2021. And just a few months after my graduation, I decided to go to work to Poland as a doctor without specialization in a small city in Poland that called Lipno. And I went there in November 2021, just a few months before the full invasion started. But for the first part of this presentation, I'm going to talk more about briefly about Ukrainian healthcare and what challenges it has right now. So the healthcare in Ukraine is a part of universal healthcare, which is based on Soviet system, Simashko system, and the Ministry of Health implements this state policy in the country in the field of medicine and healthcare. And formally, all Ukrainian citizens, foreigner citizens, and people who don't have any citizenship, they are have right to get free healthcare services in Ukraine. And right now, Ukraine has a mixed healthcare system that combines elements of public health and private healthcare provision. In the last couple of years, there were made some changes to modify and make our healthcare system in Ukraine better for the society and for government. So the new healthcare system is introduced a shift towards mandatory social health insurances. And right now, workers and employees contribute to a social insurance fund, which aims to provide more stable and predictable funding for healthcare services in Ukraine. And this change was designed to reduce dependence on state budgets. And also a new medical reform try to emphasize primary healthcare services, which is including the introduction of the network to the family doctors and or general practitioners. And right now, patients are encouraged to choose a primary care physician who coordinates, treats, and provides the preventative care. And also a couple of years ago, we have implemented electronic health records, meaning that all of the health history of patients are on the electronic services. And basically all of doctors around Ukraine and patients, they might access to the electronic records. Why it was made just to decrease paperwork and to make sure that patients' information is kept safely. And also it makes it easier for doctors to have an access to patients' medical history in any region of Ukraine, especially right now, because a lot of healthcare history was lost or destroyed, and some people left everything behind and they just went to those territories that are not occupied, meaning that all of the data that they have could stay in a paper, right? But if just because they have electronic information, it makes it easier for doctors to know the patient's medical history. And also, a new medical reform aims to decentralize healthcare decision making and giving local authorities more control over healthcare resources and services. So now I just want to talk more what challenges Ukrainian healthcare is facing right now. So due to Russian invasion to Ukraine in 2022 in February, and since that, lots of healthcare centers were attacked by rockets. Unfortunately, this is not the newest information because uh, there are not there is no updates till today. So this information was made from February 2022 or yeah, till January 2023. And in total there was 1,042 attacks on healthcare centers, meaning that not only the buildings were destroyed, but also a lot of patients and healthcare workers were wounded or have passed away due to the attacks. And unfortunately, the full invasion war also caused a lot of shortage of medical equipment, logistic to the territories that are under constant attack, meaning that lots of patients in Ukraine, they don't have access to proper health care services, just because there are different situations. But there are some cities and villages where mostly all populations have left, but there are some older people that might stay because they didn't want to leave, and all of the chronic diseases that they might have, unfortunately, they don't have proper treatment, maybe because of lack of medical staff or lack of medications or lack of equipment, or because of healthcare center is destroyed in that specific town or village. So this is one example how healthcare centers look like during the war. So on your left side, this picture was taken in 2022 in Mariupol maternity hospital. That attack was very bad, and unfortunately, some of the patients have passed away with their newborns. And here on the picture, you might see a pregnant patient, who is being evacuated from that hospital. And on the another side, you might see how the destroyed hospital looks like inside. And also, due to very frequent rockets attacks to the electrical stations in Ukraine, a lot of hospitals and healthcare centers were struggling, especially during the last winter, due to shortage of electricity. And electricity, it's essential for human living, especially for hospitals, because there is no let's say surgeon that can help patients or do surgery or emergency surgery without electricity or without light, right? And as a result, it caused a lot of unfortunate situations and a lot of difficulties for healthcare workers to give a proper healthcare for the patients. On this picture, you might see this is not how hospital looks like in Ukraine. This picture is taken from the bomb shelter that is located in one of Chernihiv hospital, which is on the northeast of Ukraine. During the air alarm starts when there is a potential high chance rocket attack coming to the city or to the village. And on that time, all of the patients that are located in the hospital, they must leave to the bomb shelter. So this is just an example how Ukrainian patients are spending hours or maybe days hiding in the bomb shelters in the hospital, trying to save their lives and lives of their babies. So now I'm going to start from the second part, which is story more about my journey to Canada. So as I mentioned before, in November 2021, I went to Poland to work as a doctor without specialization. And when war began, it was horrible time for me and for my family. And just few months after, I decided to go back to Ukraine. I just wanted to be with my family and to support them as much as I could. Unfortunately, it was not something that I would expect, right? Because living every day with the fear that you might not wake up next day is something that just I don't wish anyone to experience. And it's been few months like that just sleeping in the middle of the night, I had to wake up and run as fast as possible to the bomb shelter and shake from any sound that I could hear. And I couldn't practice as a doctor in Ukraine because in order for me to practice as a doctor, I had to finish residency in Ukraine, which I didn't because I just graduated from the med school. And in order for me to be a doctor and to help, I had to wait a year. And I just understood that it was a very tough time for me being in such a horrible fear and seeing that the situation is just getting worse and there is no better chance for me. And I still remember the day when I got notification on my phone that there were 5 rockets shooted from Belarus side. We have kind of advanced system, so we have notifications of the air alarm that is happening, or we have notifications that some of the rockets were shot from the specific region of Russia or Belarus to Ukraine, and they might predict to which city in Ukraine those rockets are going. So that was the time when I got notification on my phone that the 5 rockets are going somewhere in my region. I didn't know where it's going, but I was just in my room, and the next thing that I hear is explosions, and I just stuck and I couldn't move, and I just couldn't realize this is the life people are living, right? I used to learn in books about war, but now this is something that we are going through. So I couldn't feel safe, and that was the time when I decided to leave. And oh, sorry. And exactly on this day, a year ago, I have landed in Canada. I was really happy to be here, but also it was the toughest time in my life, just because I didn't know where I'm going. Um, I didn't know what is waiting for me here. You know, like at least back home, I could have a good job, but without a promise that I will be alive next day, right? Um, so I landed in Canada, and the first thing that I heard there in the airport was "Welcome home," and I was like, "Yeah, this is probably my new home." So a year after, I'm happy. I have a good job. I went through some difficulties as any newcomer in Canada, but I'm very grateful that I have made this the toughest choice in my life in order to be safe. And now I'm trying to help my Ukrainian community here in Canada, and I try to use my knowledge to help the way I can. Um, so going back to the time when I landed in Calgary, um, I was so lucky because I was hosted by one of the Canadian family, and they're such a wonderful family who have helped me a lot and introduces me to a bunch of their relatives and friends, and they made me feel safe. They made me feel welcomed, and I'm really grateful that I had this chance, and I was that lucky enough. Um, so at the very beginning, I have worked few surviving jobs, especially going during the winter door to door. That was very Canadian experience, very cold. Um, and I remember I tried somehow to use my knowledge, right? Because I have medical background, and I wanted to do something useful. So I was mailing different professors from the University of Calgary, and I got chance to um, volunteer for about 7 months. And then I was offered my current position as a research assistant in clinical neuroscience, which I'm really happy about. And shortly, that that is my story. This was one of the first picture taken here in Calgary. Um, I was very happy because I didn't know that winter is coming that fast. So yeah, this is my very short presentation. Thank you so much, everyone, for your attention and for being here today.